ago, an elderly man who was diagnosed with prostate cancer told me he just had prostate surgery some few weeks back. And by the time he described the procedure, I discovered that what he had was a prostate biopsy and not prostate surgery. Prostate cancer is a growing health concern globally, and to diagnose it, doctors use prostate biopsies. Now, whether you are scheduled for a prostate biopsy or you are considering it or you just want to stay informed, I'm going to share some points with you that will give you the full picture of what the procedure is about. So let's get started. First of all, what exactly is a prostate biopsy? So a prostate biopsy is a procedure where a small sample of a prostate tissue is taken to check for cancer or other conditions. It's taken from different angles of the prostate. And so these samples are then analyzed in a lab. Understanding this is crucial because it gives you a clear idea of why it might be recommended. When do you need a prostate biopsy? I'm going to share with you some common scenarios where your doctor might recommend for you to do a prostate biopsy. Number one, if you do a PSA test and your PSA levels are elevated, if your prostate specific antigen blood tests show higher than normal levels for your age, it could be a sign of prostate cancer or some other health issues, so they might recommend you that you do a prostate biopsy. Number two, if you have abnormal digital rectal examination, if your doctor feels any lump or hard spots or other abnormalities during your digital rectal examination, a biopsy might be recommended for you. Number three, if a previous biopsy didn't show cancer but your PSA levels continue to rise, a repeat biopsy might be recommended. Number four, if a prior biopsy showed abnormal cells that weren't cancerous but were potentially precancerous, a follow-up biopsy might be suggested to monitor for changes. Now, there are other imaging tests in some cases. You have imaging tests like MRI showing suspicious areas in your prostate. A biopsy might be used to confirm or rule out cancer. So these are the reasons why they are recommended, some of the reasons. And there are different types of biopsies. The most common is the transrectal ultrasound biopsy, where a probe is inserted into your rectum. There's also the transperineal biopsy, which goes through the skin between your scrotum and the rectum. The best is the MRI guided biopsy, which is performed to identify suspicious areas in your prostate. So the biopsy needle is then guided precisely to these areas using MRI imaging, either through the transrectal or transperineal approach. MRI guided biopsies are now becoming an important tool for early diagnosis, and they can help avoid unnecessary biopsies in men with low risk findings on the MRI. When do you avoid a biopsy? Number one, if you've done a high quality MRI with negative findings, you don't need a biopsy. If you're a man with serious health conditions with shorter life expectancy, the risk of doing a biopsy and treating the prostate cancer might be greater than the potential benefits. What are complications of prostate biopsy? There are some common and usual minor complications like bleeding, blood in the urine, blood in the semen, which resolve on their own. Rectal bleeding, though, is less common. There's a risk of infection, urinary tract infection, requiring the use of antibiotics. There's inflammation of the prostate, causing pain and urinary symptoms. There's pain at the biopsy site or during ejaculation, which can last for some few weeks. Many men also complained of temporary difficulty in urinating that may require the use of a catheter. There are some less common but serious complications of after biopsy, like severe bleeding, which may require hospitalization or blood transfusion. There's also sepsis, a rare life-threatening infection. There's urinary retention, inability to urinate, that also may require the use of catheters. And fainting due to a drop in blood pressure, though uncommon, it's been found in some men after the procedure. Most complications are minor and they resolve on their own, but serious issues, though rare, require immediate medical attention. If you do not want to do a biopsy and you want non-invasive ways to screen for prostate cancer, you need to watch the video I made, and I put it right here. I would like to know your thoughts. Let me know what you think about this video, and remember to subscribe to this channel. Thank you for watching. Stay informed, and I'll see you in the next video.